Union Health Minister launched the Intensified Mission Indradhanush 4.0 that aims to protect children and pregnant women from life-threatening diseases. Children up to 2 years will be covered in this drive. The government is implementing the largest inoculation drive globally, where annually over 3 crore pregnant women and 2.6 crore children are covered through the Universal Immunization Program. The Mission Indradhanush 4.0 will have 3 rounds and will be conducted in 416 districts across 33 states and UTs. What is the Mission Indradhanush? Mission Indradhanush was launched by the Government of India in December 2014. It was aimed to strengthen and re-energize the program and achieve full immunization coverage for all children and pregnant women. The ultimate goal of Mission Indradhanush is to ensure full immunization with all available vaccines for children up to 2 years of age and pregnant women. It provides vaccination against 12 vaccine-preventable diseases: VPDI, diphtheria, whooping cough, tetanus, polio, tuberculosis, hepatitis B, meningitis and pneumonia, Haemophilus influenza type B infections, Japanese encephalitis, rotavirus vaccine, pneumococcal conjugate vaccine PCV, and measles rubella Mr. A. However, vaccination against Japanese encephalitis and Haemophilus influenza type B is being provided in selected districts of the country. Mission Indradhansuh was also identified as one of the flagship schemes under Gram Swaraj Abhiyan. 16,850 villages across 541 districts and extended Gram Swaraj Abhiyan. 48,929 villages across 112 aspirational districts. About Team 3.0. It is a campaign aimed to reach those children and pregnant women who have been missed out or been left out of the routine immunization program. This is aimed to accelerate the full immunization of children and pregnant women through a mission mode intervention. Beneficiaries from migration areas and hard-to-reach areas were targeted, as they may have missed their vaccine doses during the pandemic. Intensified Mission Indradhanush 2.0. Intensified Mission Indradhanush 2.0 was launched on October 31, 2019 to ensure that not a single child in the country misses out on vaccination. It had a special focus on improving coverage in areas with low immunization. Through EMI 2.0, the Health Ministry aims to reach each and every child below the age of 2 years and all pregnant women still uncovered partially covered in 271 districts of the country.